Hi everybody, welcome to Dr Manny's YouTube Learn Shops. This is Pharmacology for Nurses Part 4, where we look at dyslipidemic medications, or medications that are used to treat cholesterol and triglycerides. The learning objectives for this session are just to briefly review cholesterol physiology and the selected medications that could be used to treat, and then reevaluate your knowledge that you've gained from this Learn Shop. So, cholesterol is in the gastrointestinal tract. Cholesterol is used by all healthy adults, and it's made by the liver. It produces 70%, the liver produces 70% of the total daily cholesterol requirement, which is approximately 1 gram. The other 30% comes from the diet. Okay, cholesterol obtained from the diet, when we eat, it's transported in the blood by lipoproteins. Now the body uses cholesterol to form cell membranes. It's very important. You've got to have cholesterol. That's why the liver makes it, 70%. However, you have a number, and one that's referred to as the bad cholesterol is low density lipoproteins, LDL. However, it is essential for constructing cell membranes. However, if you have too many, it can cause problems. High density lipoproteins, HDL, is referred to as the good cholesterol. And it's important because it helps keep low density lipoproteins in their place. So you need to have a number of these as a watchdog, as a carrier, to get rid of LDL. It takes it to the liver, and therefore maintains cholesterol within a normal range. Then you've got very low density lipoproteins, VLDL, and they transport triglycerides. Now cholesterol generated by the liver, it's important. And as the body cells extract fatty acids from the VLDLs, or very low density lipoproteins, the particles turn into IDLs, intermediate density lipoproteins, and then into LDL, low density lipoproteins. Now, intermediate density lipoproteins form as very low density lipoproteins and give up their fatty acids. There are 4 major classes of circulating lipoproteins. They're the chylomicrons, which come from the small intestine. You've got the very low density lipoproteins, you've got the low density lipoproteins, and you've got the high density lipoproteins. All are important, but if they become excessive, they can become problematic. Now, when we look at cholesterol serum levels, the ideal total cholesterol level is less than 200 milligrams per deciliter. Between 200 and 339 milligrams per deciliter is referred to as being intermediate. Above 240 milligrams per deciliter is high. LDL cholesterol, low density lipoprotein cholesterol level, should be less than 130 milligrams per deciliter, but this depends on your organisational policy as well, or your laboratory levels. HDL cholesterol level should be greater than 55 milligrams per deciliter for women and greater than 45 milligrams per deciliter for men. They keep an eye on your LDL cholesterol level. Triglycerides should be less than 150 milligrams per deciliter. Now, what are the consequences of high serum levels of cholesterol? Well, atherosclerosis is one of them. If you get an accumulation of cholesterol in conjunction with other pathophysiology that occur in your arteries, you can get the deposition of cholesterol and start the process which results in arteriosclerosis. This results in lipids creating a fatty streak, fibrofatty plaque, and then complicated plaques and calcification, which results in arterial obstruction. If it occurs in the heart, coronary artery disease. if it occurs in the kidneys, renal vascular disease, if it occurs in your brain, stroke. Now, lipid-lowering agents consist of resins, fibrates, statins, niacin, and absorption inhibitors. Resins basically are bile acid sequestrants. And the liver normally converts cholesterol into bile acid. The bile acids move into the intestines. The bile acid is returned to the liver, and the result basically equals higher blood levels of cholesterol. Cholesterol excreted with bile acid into the small intestine. Some is reabsorbed, some goes into your feces. But bile acid secretants block bile acid reabsorption. So more goes into your feces and cholesterol is eliminated. One of the medications used to lower LDL levels is cholestyramine, questrin. And this lowers high, low-density lipoprotein cholesterol levels. It removes bile acids from the body. It binds bile in the gastrointestinal tract to prevent reabsorption. Its action, it binds bile acids, interrupts the enterohepatic flow. There's recirculation, increasing hepatic LDL-C receptors, increasing LDL cholesterol removal. The dose, according to your organisational policy, but typically 16 to 24 grams per day. Indications are for moderate, low-density lipoprotein cholesterol. The major effects are flatulence, heartburn, and constipation. You've also got cholecystipol, and this is a class of medication also called a bile acid sequestrant, and it's prescribed in conjunction with diet modification, as all of them are, to decrease the amount of lipids such as LDL-C, low-density lipoprotein cholesterol, in people with high cholesterol levels. The indications are for moderately elevated LDL-C and atherosclerosis. They bind to bile acids and interrupt enterohepatic flow. Recirculation increases hepatic LDL-C receptors and increasing LDL-C removal. Major effects are flatulence, heartburn, and constipation. The next group we have are fibrates, and these are plasma lipoprotein lipase activators. Now, fibrates lower blood triglyceride levels, and they do it by reducing the liver's production of very low density lipoproteins of cholesterol, in addition to increasing the removal of triglycerides from the blood. Now, one example of a fibrate is gemfibrozil, and this is a class of medication that we already said was a fibrate, and it's used with a low-fat diet, as all these medications are, to reduce triglycerides and essentially to increase HDL, the good cholesterol in the blood. But in conjunction with increasing HDL, it therefore lowers bad cholesterol, LDL, or low-density lipoproteins. Now, the action of gemfibrozil is to decrease LDL-C, triglycerides, and the total cholesterol, and also increase HDL cholesterol. Dose is typically 600 milligrams in divided doses, and the indications are for atherosclerosis and hypercholesterolemia. Hypertriglyceridemia as well. All the cholesterols. The major adverse effects are, however, cholelithiasis, hepatotoxicity, and potentially cardiomyopathies. Another one is bezafibrate, and this is also a fibrate, and it's used with low-fat diet as well as the others to reduce triglycerides and increase HDL and lower LDL. And it's used in conjunction, typically in combination with a statin in people with high triglyceride levels, or prescribed when statins can't be used to lower cholesterol. So it's used in conjunction with statins, or it's used when statins can't be used for some reason. The action is to decrease low-density lipoprotein cholesterol, increase high-density lipoprotein cholesterol, and the dose is typically 600 milligrams, again in divided doses, 200 milligrams TID. The indications are hypertriglyceridemia, atherosclerosis, or any of the hypercholesterolemias. The adverse effects can be renal failure, alopecia, and myositis. Statins are one that you may be familiar with. These are HMG-CoA reductase inhibitors. And statins block an enzyme called HMG-CoA reductase, and it's this enzyme that's involved in the synthesis of what is called mevalonate, and this is a naturally occurring substance that is used by the body to make sterols, including cholesterol. One example of a statin is lovastatin, and it's used in conjunction with a low-fat diet to reduce triglycerides, low-density lipoproteins, and increase high-density lipoproteins in the blood. And it works by reducing the amount of cholesterol which is synthesized by the liver. So therefore, what does it do? It inhibits secretion of lipoproteins from the liver, therefore decreasing LDL, increasing HDL, decreasing triglycerides. The dose, maximum 80 milligrams per day, but it can be given up to 80 milligrams. So typically 20 milligrams daily. The major adverse effects, unfortunately, for statins are you can get liver damage and cardiomyopathies. And that's why liver function tests are important to be done to monitor whether this medication is harming you. The indications are for hypercholesterolemia and hypertriglyceridemia. Another example is simvastatin, and again used in conjunction with a low-fat diet, reduce triglycerides, reduce LDL, and increase HDL cholesterol in the blood. Again, it works by reducing the amount of cholesterol which is produced or generated by the liver. And as with all statins, it typically inhibits secretion of lipoproteins from the liver, therefore decreasing LDL, increasing HDL, and decreasing triglycerides. However, the major adverse effects are again potentially liver damage, which has to be monitored via liver function tests. The indications are for any of the increases in cholesterolemia. Niacin, or nicotinic acid, is a member of another group called the lipolysis inhibitors, and it's a potent inhibitor of lipolysis because it reduces free fatty acids in the plasma, and it inhibits free fatty acids as a change from adipose tissue to the liver, and it reduces hepatic triglyceride synthesis and increases hepatic lipid oxidation, which basically means it's breaking down cholesterol. That's what it does. So what does it do? It inhibits secretion of lipoproteins from the liver, therefore decreasing LDL-C, decreasing triglycerides, and decreasing very low density lipoproteins. The indications are, as with all of them, hypercholesterolemia, hypertriglyceridemia, And the major effects are, or the major adverse effects are, flushing, cardiac palpitations, and gastrointestinal discomfort. The last group are absorption inhibitors, and the most common one is ezetrol or ezetimibe, and this is a selective cholesterol absorption inhibitor that effectively blocks absorption in the intestine of dietary and biliary cholesterol, and it undergoes a change to a single metabolite which is localized in the intestinal wall where it prevents cholesterol absorption. Glucuronidation is the term. Ezetrol inhibits absorption of cholesterol in the small bowel. It decreases cholesterol delivery to the liver, and in doing so reduces total cholesterol, low-density lipoprotein, triglycerides, and, as the others, increases HDL cholesterol. It's recommended to be taken in the evening, as most of the other medications are as well, especially the statins, because it's during the evening or the night time or in the later hours where the liver produces cholesterol, and this is where it's eliminated or blocked. The indications are primary hypercholesterolemia, or if you're combining it with a statin, an HMG-CoA's reductase inhibitor. The major adverse effects of this medication is joint pain, arthralgia, abdominal pain, and diarrhea. So if we review, what can you remember? Can you name the two methods for cholesterol synthesis? How is cholesterol produced? It's produced by the liver and accumulated as a result of your diet. Name one bile acid sequestrant medication. So you've got cholestyramine, also known as Questran, or cholestyramine, also known as Colstid. Can you name one fibrate lipase activator medication? Think. You've got gemfibrozil, Lopid. You've got bezafibrate, Bezalip. What about the statins? Can you name two statin, and there are numerous that we haven't mentioned, two statin HMG-CoA's reductase inhibitors? You've got lovastatin, simvastatin, and there are many more, such as atorvastatin, also known as Lipitor. Can you name one lipolyase inhibitor medication? Just one. Nicotinic acid, also known as niacin. Okay, that concludes this Dr. Manny Learn Shop, Pharmacy for Nurses, Part 4. As I've said previously, if you think this has been of any benefit to you, please recommend it to your colleagues, and please move on to Part 5, 6, 7 and 8, which can be located on your YouTube.